What's the safest technique in buttock augmentation with implants? Well, I got the answer for you, and I feel I have developed a technique that provides my patients with great outcomes with the least risk for safety as well as decreased risk of complications. And this technique is called a dual plane technique. And so I developed this technique really to get the most out of the previous techniques that we use for glute augmentation. The idea is you want soft tissue coverage, you want an implant that's stable and not move, and you want space available to have larger implants. And so this technique answers and addresses all three issues. So the implant is placed into the muscle on the bottom half of the butt, and on top half of the butt it's actually on top of the muscle. In that space, the implant is able to be kind of cuffed or kind of held with a soft kind of a flap of the muscle, and it supports in the lower part of the butt. So you're able to also have a larger implant because you have the extra space associated to an implant on top of the muscle. So larger shapes, larger profiles are able to be accommodated for patients who have that desire. More soft tissue on the lower part of the butt reduces visibility of implants, which is a very frequent common issue associated to implants on top of the muscle. It's called the subfascial technique. And the last thing is that implant being the muscle on the bottom part of the buttocks gives it stability. That implant will not slide off the lower buttock fold. That implant is stable because it's actually in the muscle. So this technique I've found over the course of the past 4 years that has been consistent, has a very low complication rate, and patients have been very satisfied. So check out my website to learn more. Thanks for following.